Juliet, can you quickly talk about the opportunities, gaps, and then some of the challenges with regards to male breast cancer?
Hello, Yvonne?
Yes, I'm here.
Hello?
Hello.
Oh, were you talking to me?
Yes.
Yeah, what was the question, please?
Yes. So the question is that Eric is here as well. So maybe Eric can help whilst you attend to the baby. So you attend to the baby, let Eric help. Eric. Hello, is Rita here? Eric.
Yes, I can hear you.
Yes. So what are the opportunities, gaps, and challenges related to male breast cancer campaign in Ghana? I mean, you are on the field. What do you think are some of the challenges?
Okay, so since that kind of cancer is not common, as Juliet said, 1 in 1,000, it's not common. So they tend to wonder how possible, how is this possible? Where is the breast? As a man, do we have breast at all to get this cancer? So they tend not to accept whatever it is. The point is that because it's not common, there's not much theory about men breast cancer. As Juliet said, men and female risk factors are the same. They are almost the same, cause treatment and others. So much is not done on it. And so it's difficult. And that's why when we have someone like Mr. Pakwesi on board who is a victim and he comes out to say that it is true. I have suffered it. The seeing is believing. They want to see before they believe. So it has become much a challenge for men to accept. Even in screening, Kolebu Polyclinic screening, you see women coming. Hardly will you see a man, try to join a queue to be screened because they think, no, this is not possible. So yes, it's a challenge. But as we go forward, I think they will come to term that it can also affect men. And when that happens, I'm sure they will accept campaign and then come on board as well.
Yeah.
All right. Can I add on?
Yeah,
so
yes,
I think one of the challenge is that the awareness is not there. I think over the years we have focused so much on female breast cancer that we've ignored, the male breast cancer. And now that the awareness is starting to come, we are seeing more. I think we are seeing more of them because of the awareness. So it's an opportunity for all of us to that are at forefront to just continue with the campaign, that it can happen. Males also have breast tissue and it can happen as well. And just continue with the awareness. Once the awareness is there, we have somebody like Mr. Pakwesi that is gonna share his story with us. If this goes out, this conversation goes out, somebody may look at it, may watch it and also share it with somebody else that this can happen. I'm pretty much sure there are a lot of people that have died, a lot of guys that have died from breast cancer without knowing that it was even breast cancer because we have never really focused so much. So I'm glad that your organization this year is just focusing on male breast cancer and bringing the awareness. That's what we can do. The one effective way of doing this, getting more people to get screened and things like that will be bringing the awareness to people.
Right. And so I think that we've had a lot of success from my part. When we actually skewed the campaign towards men. And so this is what we've done. When we've had men come in, then we asked them, go bring your girlfriend, go bring your wife, and go bring your children. So guess what? One man is screened, and then he goes in and he comes along with wife, children, and we have a whole family actually going through the screening procedure. And so this is what I think. I think that we should begin to talk about male breast cancer and get the men, I mean, as the traditional family heads, propagators of this agenda. And I think that is one of the huge fights towards success in breast cancer awareness. If we could get the men as family heads propagating the real essence of screening and care and treatment, I think we are halfway through, you know. And so clinical psychologist angle is here.
Yvonne, Yvonne, please, add up.
Yeah. Yes, please, go ahead.
Hello, can you hear me? Good.
Yes, we can hear you.
The men too, good, thank you. Good. The men, right? I mean, for experience, you realize that when the women come in, you ask, how did you see it? Well, they tend to give the credit to the husbands. That, oh, it was my husband who saw it. It was my husband realized that there is much difference in both breasts, and my husband did that. So you realize that they are rather helping the women to detect it. Even though the women themselves, at times, they don't notice it. You know, the husbands see that, no, this is not the breast I used to know. And they accompany them to the hospital. So in as much as they are helping their wife to detect, because they pay more attention to it than themselves, you know, because as Juliet said, education is not that much. And so, yes, when we educate, we should let them know that they are also at risk.
All right. Thank you so much. Ango Salisu is a clinical psychologist with a radiology unit, if I'm right, Kolebu Teaching Hospital. Ango, can you help us understand how you are dealing with the male breast cancer upsurge and some of the gaps, opportunities, practical challenges, and how your outfit is dealing with that challenge? Ango. Okay, right. Okay, is Rita here? Is Rita here? Okay. Is Parkweti here? Is Parkweti here?
No.
Parkweti is not here. Okay. I wanted him to throw a bit more on his experience on male breast cancer and also to help us understand. But Eric, you are here. Probably you can give some tips on male breast cancer from an experiential view and how we can take the campaign ahead. Hello, Eric.
Yes, Yvonne.
Yes. So our male survivor is not here. So can you tell us from a practical perspective how we can take the awareness to a more practical level from your experiential view on the field?
Please come again. The network was breaking.
Okay, so from your experiential view, how can we address some of the notable gaps you've mentioned and the way forward critically? Then we can open the floor for anyone with questions.
Okay, good. So first of all, we have to deal with stigma. You know, it seems to be normal for a woman to get breast cancer than for a man. So if you listen to Mr. Pakweti's experience, you realize that because of stigma, for a long time, he was not coming to hospital. Because coming to hospital to queue with women on the same condition is quite frustrating. So stigma is one of them that we have to address. Let people know that, it can also affect men. Is one. Two, I don't know if it will be possible that, treatment centers, we can give priority to men when they come. Because I was saying like this, when Mr. Pakwesi comes, we wouldn't want him to sit among the women at the chemo seat. you know, you realize that he's not comfortable, and the woman will be, does it affect men also? And they tend to, you know, so what we do is that we have to separate him, maybe take him to a side ward so that at least he can have that, you know, he can feel comfortable. So, and then also, education is key. Education is key. I mean, we are focusing too much on the women. And I'm sure by 2019, 2020 statistics, you realize that, I mean, it may even move from 1 in 10, maybe 2 or 3 in 10. You realize that they are also, you know, closing the gap between female breast cancer and male breast cancer. So we have to tackle it early, you know, from the base. Now that it's not common, we should tackle it early from the base so that it wouldn't be like now men are also competing as the, you know, women. So yes, we need to do more. We need to do more. We have to encourage someone like Mr. PsycCare to come out, you know, to share his experience. There are some out there who are not even coming to hospital, I'm sure. If they are to come to hospital to get the statistics, realize that there are a lot of men in the system that are having this disease, but because of stigma or one way or the other, they wouldn't want to come. Okay, thank you.
Thank you so much for that brief presentation. Please, the floor is open. Suggestions, contributions, the way forward. Male, female breast cancer. Yeah. Are there any questions, suggestions, contributions in terms of the way forward? Okay. So Juliet, if you can quickly start for us, what is the way forward, basically? I mean, from a global perspective, what is the way forward?
The way forward in male breast cancer is just the awareness campaign has to keep going. You know, October should not just be focused on female breast cancers, you know, and like I alluded to earlier, I think you guys are doing a great job for having that, like, you know, the focus on male breast cancers and the fact that when they come in, then they bring their wives and their daughters along with them, you know. I think globally, it's not even just Ghana, but even here in the United States, the awareness is not that great when it comes to male breast cancer. So we just have to keep the campaign going. You know, we just have to keep the campaign going. Anytime you have an opportunity to talk about breast cancer, you know, make sure that you do mention that males too can have it. You know, there are people that get a platform to speak on radios, on television. You know, these will go far to the various villages and the small towns. So anytime the opportunity is given to you, please just make sure you bring that awareness up. The way forward is really to start campaigning more about male breast cancer, not to ignore female breast cancer, but I think over the years we've spent too much time on the females that we've ignored the male. And I'm pretty much sure a lot of people that are dying from this disease without even knowing that it's breast cancer. You know, people are calling this, pompo or something like, you know, that happened, but most likely probably breast cancer, you know. So we just need to keep the awareness going. We just need to keep educating the churches especially, you know, organize programs at the churches, because I think if it's coming from the pulpit, people are more likely to, like, you know, listen than if we stand somewhere on the street trying to preach this. So like all the healthcare people, I will entreat each and every one of us that if we have the opportunity, you know, just organize programs for your churches and speak about the awareness. It doesn't take much. You go on the internet, you can find all you need to know about male breast cancer and just educate people about it. And at the end of the day, people need to seek medical help. You know, we are all Christians. We all hold the same beliefs. But I always say that as physicians and healthcare professionals, we are extension of God's grace. God has placed us here with all this knowledge to be able to help his people. And so if you find a lump or something that is abnormal, you have to seek a professional help. You know, all these herbals and going to the gods and whatnot is not helping either. And I think it's killing more people from breast cancer than actually helping people.
Right. Juliet, in 5 seconds or minutes, can you tell us why you started the Cancer Support Network?
Oh, okay. So the Cancer Support Network, I started that organization to really reach out to people in Ghana that have been diagnosed with cancer. And basically here in the States, we have a lot of support network. And as an oncologist, I know what patients go through. It's not even just the financial aspect, but the social aspects and, you know, just the support. I had an aunt when I was around 16 years old that died from breast cancer, and she did not tell anybody about it. By the time we find out, literally blood was just gushing out from her breast, and within 3 weeks, she died. And the reason why she didn't tell anybody about it is because at that time, it used to be thought of as like, you know, the disease of the evil, or maybe you did something to somebody that, you know, the person did voodoo or something like that, you know, so the acceptance itself. So we came up with this organization really to support cancer patients with financial support, social support, and just like, you know, being there for them, letting them know that there's somebody here that is going to walk this journey with you. You are not going to feel like you're alone. If you don't have anybody to talk to, we are here. You can talk to us. Whatever support we can give you, we try to give financial support because that's one of the major issues back home in Ghana, people being able to afford their care. And because of that, a lot of people are not going to the hospital because they go and they tell them, oh, go and bring money for your biopsy. And then that's it. We actually, I think 2018 or 2019, we had a patient that had come to Kuala Lumpur. They told her about biopsy. She should go home and bring money, and they didn't come back till like 2 or 3 years later with, like, you know, literally metastatic disease everywhere. So these are the people that we want to reach out to. And I can't say enough, Eric has been a tremendous support for this organization in terms of helping us identify people that need help, and, you know, helping us to reach out to these people and giving the resources, you know, like, you know, helping us reach out to people that can actually help with counseling and all those things has been really great. And we are really, really appreciative to him. So this is the reason why we started, just to bring support, all sort of support to people that have been affected by cancer.
Right, right, very well. Good work done. I think cancer is a psychological journey, and beyond the physical manifestation of whatever it is. I mean, when you speak to the women, I think that the state of the mind and even the perception of the disease and every part of, you know, the treatment process is psychological in perspective. And so I also think that beyond the social support, I think that one of the critical gaps in cancer, you know, the awareness of cancer networking in Ghana would have to do with getting the appropriate psychological intervention. I mean, the men and women know that there are people trained enough to even help them understand the whole journey of cancer and disease burden and management. Then obviously we are halfway through the fight, essentially. Dillys, are you in there? Can you tell us about, can you give us some closing message?
Okay, thank you.
Right.
Please, can you hear me?
Yeah, we can hear you.
Yeah. To add to what Auntie Juliet was talking about, I think we in the cities, we are blessed, or we had the privilege to even have access of screening and this mammogram. Those in the remote areas, they are not aware of what is going on at all. So I think most of the education must be extended to the remote areas. And when you talk of, it's not too far from Accra. When you mention certain things, people ask, so does it happen? So do we have that in Kolebu? People are not even aware that we have that. So I think the education must go as far as to my village and other places. Then the next one, I think we should involve the religious bodies, leaders, so that we listen to them more, like our traditional chiefs. So we should involve them in the campaign. Right. When they intervene, do that anytime they preach. I think they can even use 5 minutes to advertise on that, and that will go a long way. Yes, I think that is what I have to. Yes, then in conclusion, I will say that the screening and those things that we are doing, it should go far. So that we have to give massive education so that to differentiate between breast cancer and evil diseases, so that people do not underline them as evil sickness, so that early detection they come, because most of them find it as early as possible, but coming to the hospital, they think it's one or the other, so they stay absent at home. When it's getting to the end, then they come. So I think we should also try as much as possible to welcome them, educate them, and let them know that it's also a kind of disease that can happen to anybody at any time. So I think the education should go far.
Right.
Yeah.
Thank
you so much.
The floor is open. Anyone want to make some additions, subtractions? It's free to do that. Contributions. I like your closing statement and the fact that, I mean, it can happen to anyone. It's a human condition, and so it can obviously happen to anyone. And so we need to reorient our views on cancers and and how it is represented in our societies. Any suggestion? Any more suggestions?
Yeah, yes, Yvonne.
Yes.
I have another one to say.
Right.
I think it's very important. Those of us that have survivors,
right.
It is very important to engage ourselves in education.
Right.
We might be in a family house, even with our siblings. We don't want them to know.
Right.
So I think we should set ourselves as an example so that others will look upon us and go to the hospital. At times they call me to Kolebu, and when they see me, I even show them my breast, and you see people, hey, so if you do it, you can become this. Oh, wow, then we are going to do it. So I think those of us we are blessed to be alive, we should set ourselves as an example and educate others.
Right.
So that they also imitate us, yes, and do the right thing, yes.
Right. So that we can also break the stigma. Right. Go on, Juliet.
Is there like a support group for breast cancer patients that meets like maybe once a month? You know, I don't live in Ghana. This is one of the things that, you know, if I were in Ghana, I would really want to start up something like this, that once a month, I'm part of our breast cancer support group at my hospital, and we meet once a month in which, like, you know, we bring food and people share their stories, what they're going through, like, you know, people that have just been diagnosed, those that have survived, those that have completed, like, you know, all stages of breast cancer. And it's not just breast cancer, other cancers as well, but all stages of breast cancer, we meet once a month. Sometimes it's even just going to do painting. You know, we all go together, we share our stories, because I think that support group is also a very important thing. Like, you know, once we detect that somebody is diagnosed with breast cancer, not just even meeting with a psychiatrist, right? But then meeting with people that have also, like, you know, been through it. These support groups are usually very helpful, because when people come and they hear the story, somebody who is, like, you know, declining, like chemotherapy or not, like, you know, they come to support group and they hear other people's story, you know, oh, I went through the chemo, I did my surgery, and now I'm here, everything is fine. You know, that encourages patients more. Like, you know, experience is a better teacher. You know, I think that encourages people more, but I'm not sure if something like that can be set up in Ghana, in which, you know, we can have these support groups.
Okay, so I'll try to answer that. I don't know if anyone can also support Juliet's question. Okay, so basically I've tried to put together one of the critical roadblocks to support groups in Ghana is stigma. So stigma again. It's even difficult to put women together to create an understanding of that essence. And so they tell you that even with the cancer experiences, there are variations, you know. And so, for instance, if it's breast cancer, within that sector, so you have women who, for instance, could afford treatment, and so don't think that, you know, they can be compared or related to women with financial burden. We have the women who survive the early stages who also think that, well, I'm different from someone who is at the latter stage of cancer. I think stigma continues to be a very strong block. But from a psychological perspective, I'm hoping that as more people begin to identify with the cause, then we can progressively talk about acceptance, and support groups can be meaningful. Because if you still have women struggling through the phases of the experience, you know, accepting the experience, then, you know, putting them together becomes a challenge. So what PsycCare has done over the months is to try to lump the women together. So it's women support group, so that no one feels that you are talking too much about my issue, or I need to be protective. I'm a pastor's wife and I don't want to be in the open. You know, I hold the status and I still want to be closeted. And so, yeah, we are putting measures to, you know, limit the roadblocks and ensure that women are put together.
Right? It takes us back to education.
Right.
And, like, you know, when these women are diagnosed with a breast cancer, like, you know, education, what is the support system there? Like, you know, what is the goal of the support system? You know, it takes like 3 people. If we're gonna wait for 10 people or 20 people, we may not get that. But the 3 people, like, we have Dillys, we have some other people that have come forward, come together once a month, and then we start growing to people that are being diagnosed early, like, you know, I mean, people that are getting diagnosed, that once you are diagnosed, we tell you about, like, you know, we have a support group that meets once a month, people like you that have gone through the same thing, and just, you know, little drops of water makes a big ocean. You see what I'm saying? And I totally identify, like, you know, I understand where you're coming from, but I think we got to start from somewhere.
Right, right.
Okay, so I think, let me just add it. So over the years, what I seek to do at my department is that I try to solicit for funds, okay, and organize get-together. Now, this get-together is a blend between newly diagnosed and those who have been treated and doing well. So if like 20, I select 10 from here, 10 from here, we go together. I think Dillys has been there a couple of times, which every year, if I get sponsorship, I do that. We go to a place, we play music, we dance, we share experience, we invite resource persons, come and talk to them. And by the time they leave the place, you realize that the newly diagnosed one are encouraged that, oh, okay, so this
Okay, Eric's network. And Yvonne, you're muted.
Right. So I think we have just 10 minutes. So we want to wrap up and want to open the floor. Any more additions? And then we can call it a day. Any more suggestions from the public? Can we see your faces?
Oh, well, you can check us out
yes.
at www.cancersupportnetwork.org. There are a lot of resources there. You can reach out to us through there, through our email. If you need help, we try to help as many as we can.
Right.
Or even if you just need to talk to an oncologist, you know, I've had patients reach out to me because they were not clear with their diagnosis or they had some questions that were not answered. And I try my best to, you know, break things down to people. So you can reach out to us anytime.
All right, very well. Okay, so there's also the PsycCare Foundation, and you can also reach out to us. We're looking forward towards more collaborations with other women health organizations in support of not just breast cancer, but women's welfare. And so you can also reach out to us in terms of support, psychological support, very, very critical. We have people on the standby who are ready to counsel and provide the guided advice that you need to survive this phase. Please spread the news. Early detection is key. And so let's get everybody on board. It's a collective effort. Let's get everyone on board. Let's help with the process of destigmatization. You know, let's try and get people understand that cancer is a human condition. And so if anyone is affected in any way, there's support for the individual. Yeah. Any additions? Please don't forget to leave your email in the chat box. I'll be so glad to, you know, get back to you, and especially with our follow-up meetings, not just on breast cancer, but mental health as well. So any additions, any contributions, we are open. Okay. Okay, Eric is joining. So Eric will close the meeting for us. Okay, so Eric is joining. Okay, Sianoki.
Hello, Doctor.
Yes, so do you have any additions to us in terms of the psychological approach?
Yeah. I just want to say thank you.
Yes, Yvonne, I'm back.
Yeah, okay. Eric, so we are ending with you. We have less time, so we are ending with you. Yeah.
Okay, so quickly what I was saying is that, so when this year I've not gotten any sponsor, which I hope to get, so that I can bring the women together again, and then we share experiences. And then also I plan on bringing all the survivors under one umbrella. All the survivors, anyone living who's gone through breast cancer, I try to bring all of them together, which I left in the care of Dillys. I'm sure she's working on it. And then also, if I can get this PAG, what I call PAG, Professional Survivors Group, when they also come together, you know, they have the monies, There are corporate women, bankers who have gone through that.
Okay, I think Eric is off again. And so we'd like to end the meeting. Yeah, Juliet, do you want to end for us? Yes.
Oh, you know, early detection saves lives. So
Yes.
get screened, get your husband to, like, you know, touch your husband's nipples and like, you know, their breasts, examine them too. If you find a lump, encourage them to seek professional help. And, like, you know, let's encourage each other. Anytime we have the opportunity to talk to people, you know, we should use that opportunity to educate people, both men and women. This is a disease, you know, it's a real disease that can happen to either sexes. So we should all pay attention to our body.
Right. Thank you. Thank you, everyone, for joining.
Thank you for having me. Yes.
God bless you.
Thank you. I really
Thank you. Can we see your faces? Can we see your faces and a little bit of wave from you? Right.
Yes.
Oh, okay. I can see Elizabeth. I can see Dillys. Right. Tricia, can we see your face? Noel, Lancaster, can we see your face? I know you're in there. Please, just give us a wave.
All right.
All right. Okay. Bye.
All right. Thank you.
Bye, everyone. Thank you for joining in. Please leave your email addresses here.